This program, while curated to help you improve your health, contains general advice and should not replace the individual advice of your medical practitioner.
How important do you think people's emotional wellness is to their gut health?
It's so key because the gut is our main receiver. I mean, it's our intuitive voice.
So what was it about it that made you lose your way?
I think it's many things. It's the hours. At times I calculated I was working 100 hours a week.
What do you think is the deeper reason that people get sick?
I mean, I think ultimately people get sick first in the mental emotional realm.
In life, it's normal to have ups and downs. But what do we do when we get stuck? I've always been fascinated by the healing journey. Why do some people get better while others fail to make the shift? Welcome to the Expert Series, where you'll meet 25 of the world leaders in health and wellness, discussing their passions and what it takes to make your shift.
There's an electrical feeling in the room.
I had to be a mom. It was so important to me.
I've always been a pain in the butt, and I love that.
I knew that I wanted to help people.
I'm Katherine Maslen, and this is The Shift. Hi, I'm Katherine Maslen, naturopath, author, and host of The Shift. In the Expert Series, we share the insights, stories, and expertise of each of our amazing experts. You might have met them on season 1 of The Shift, where we took snippets of these conversations and put them together into the series. If you haven't listened to season 1 yet, I'd recommend going back and listening to episode 1 on what it takes to make a shift in your gut health. We'll provide a link in the show notes. In this episode of the Expert Series, we have Dr. Vincent Pedre, an author and integrative doctor based in New York City. Dr. Vincent is a board-certified internist who's been in private practice since 2004. He is one of the most holistic integrative medical doctors out there, practicing a blend of Western and Eastern medicine, including nutritional therapy, acupuncture, and mind-body medicine. He is a well-known wellness advocate in the United States, having appeared on many media outlets, including The Dr. Oz Show, Good Morning America, and others. He's also the author of the amazing book, Happy Gut. I absolutely love Dr. Vincent's style of practice, and I really resonate with a lot of what he says, as you can tell during this interview. I was supposed to interview Dr. Vincent in person in New York City. However, due to a head cold, we couldn't meet up, so we had to conduct the interview online. So please excuse the lapse in quality that you'd be used to when you listen to The Shift. But I assure you the info is just so good that you'll hardly notice. Listen out for how Dr. Vincent navigated the struggles that he had with the mainstream medical model and the internal conflict that this caused for him as a doctor. We're also going to hear how his personal gut health story led him to know about it and help others with gut issues, as well as some insights on emotions and moods. First up, Dr. Vincent introduces himself.
I'm Vincent Pedre. I'm a medical doctor with a specialty in internal medicine, but I've also, over the years, trained in yoga and medical acupuncture, and then decided to train in functional medicine. So I'm at the Institute for Functional Medicine certified practitioner. And I am faculty for the Institute for Functional Medicine. I run my own practice. I write for Mind Body Green. I have a newsletter. I have a whole supplement line for my Happy Gut program. God, how many things do? I consult for orthomolecular products as their chief clinical expert in the Pillars of GI Health program. Cool thing. I get to do all this stuff.
Fantastic. So where are you from originally?
Originally born in Miami, Florida, and I spent a good part of my life there, but now I can say that I've almost spent as much time in New York City.
What led you to be doing all these things and knee deep in gut health? What's been going on?
So in many ways, I was my first gut patient without really realizing that I was a gut patient. And the reason I say that is because I had developed a plethora of gut issues that were so ingrained in my growing up that I just thought that that was a weakness of my body. So I had a very sensitive stomach. I had what people would call IBS, irritable bowel syndrome. Definitely my abdomen was my receiver of information. So, a lot of people say that the gut is the seat of the intuition. Well, for me, it speaks very loudly. But it was also disrupted by a lot of things that happened during my childhood, particularly being put on antibiotics. I think there was an overprescribing of antibiotics back in the 80s when I was growing up. And I was probably on antibiotics 3-4 times per year. And I kept getting sick over and over. And they said that my immune system was weak. And what I can look back and say is that the antibiotics caused a major disruption in my gut microbiome, which never could recover because I was on antibiotics several times per year. We know now that it takes a couple of months to recover from just one 5-day course of a Z-Pak, a Zithromax. That can take up to 3 to 6 months to recover from that. And for Cipro, which is a fluoroquinolone, was among the strongest antibiotics out there, that can take up to 12 months to recover. So my gut microbiome had no opportunity to recover. And what I understand happened was I developed leaky gut syndrome. As a result of that, I became sensitive to the foods that I was eating a lot of, especially dairy and wheat, gluten. The food supply over that time was changing, and the wheat that was being produced was having increasing amounts of gluten as part of this whole hybridization process that they were doing to make wheat more drought and climate resistant. In retrospect, I was trying to figure out why my immune system wasn't working properly. So my goal as a child, and I became very health obsessed, was how can I stop myself from getting sick all the time? Anyone would sneeze on me and I would get sick. So it wasn't until I went to medical school that I had my first aha moment, because I stopped having as much dairy, and it was just kind of coincidental. It wasn't pre-planned. It just wasn't convenient to eat cereal with milk in the morning because I had to rush out to get to my classes. And I was always very observant. I was thinking, I'm not eating dairy like I used to, so I wonder what will happen. Well, I stopped getting sick as often. And so while I was going to medical school, where maybe you get 2 hours of nutrition, I was very curious about what nutrition and how it could affect my health.
What made you want to become a doctor?
The earliest memory I have was actually sitting with my mother at the doctor's office when I was 7 years old. And I looked at her and I said, I'm going to be a doctor when I grow up. And I said it very authoritatively, like there was no arguing, there was no questioning, that this was exactly what I was meant to do. And it's sort of ironic because I despised going to the doctor as a child, and I was, as any child, I think maybe perhaps more than other kids, deathly afraid of getting an injection. Once I got to medical school, it was quite a high to be there, and I really loved my classmates. But getting to medical school was a little bumpy because I almost backed out at the last minute. I almost didn't go to medical school because of my sheer fear of needles. I couldn't get my blood drawn or get a vaccine injection without ending up on the floor, passed out. And that happened every time. And I started thinking about it, that once it became a reality that I had taken the exam and I was going to be applying to medical schools, that, okay, this is not just a fantasy. This is not just some idea out there, but this is a reality. And I'm going to be hanging around needles. And I don't feel comfortable with needles. So I started thinking about it. And I came home for the holidays around Thanksgiving and sat down with my parents. And I told them, I don't want to be a doctor anymore. I'm just going to go to Wall Street. Of course, my parents sat me down, and it was probably like an hour-long conversation. And in it, I finally revealed to them, I think, that I was afraid of needles and all that. And they convinced me that I was going to go to medical school because by then they had decided that their son is going to be a doctor. So,
they've invested a lot in this already.
And I decided, okay, I'm, a little moment of reprieve. I'm not going to think about it too much. But then as it got closer, then I was 8 months away and I had finished college a semester early. So in 3.5 years, I moved back to Florida, to my parents' house, and just taking a sabbatical before medical school. And I started exploring, and I decided, well, I need to figure out what is happening to me. Why does my heart race? Why do I break out into a cold sweat? Why do I pass out every time there's a needle? And that's what led me to the discovery that I think started shaping the type of doctor that I would become. So there are no accidents. And I found this book by Herbert Benson called The Relaxation Response. And it was all about how to breathe. And they had been studying this at Harvard University Medical School, and how using breath can lower blood pressure. It alters the balance between the sympathetic and the parasympathetic nervous system. So I started learning about that, and I thought, okay, I'm going to change this balance within my body. And I started doing those breathing exercises. And my goal was that by the time I went to medical school, I would be able to get my hepatitis B vaccine series, which was required for school, and that I wouldn't pass out. And so I practiced. And during that time, I discovered yoga. I discovered meditation. I started doing guided meditation. I discovered Deepak Chopra. I discovered spontaneous healing by Andrew Weil. And I had all this time. I was reading all these books, doing yoga, meditating, breathing. And I had no idea that while I was trying to solve a problem, which was I needed to be able to become a doctor, that I was actually shaping the type of doctor that I would become.
And so you went into medical school probably with a bit more insight about how holistic things are and how the body, I guess, is a little bit more than just our skin and bones. How did that shape the way that you received that information as you had to go through med school?
First of all, I continued meditating pretty much every day when I got back. After the end of the day, I would meditate for about 30 minutes. Back then I was listening to guided imagery because I still was a beginner and I didn't really know how to meditate. And I was known as the Zen guy. This was the mid-90s. So just think back, over 20 years ago, yoga, meditation, that was not mainstream. That was still quite an outlier. And just think now, 24 years later, and it's mainstream. So many people do yoga. People in finance are meditating because it improves their performance. But back then it wasn't. So I didn't tell any of my friends what I was doing because I thought, well, I don't want to be judged or thought that I'm weird. But they all knew me as being so calm. I was always really calm, and they would come hang out with me nights before a test because I would calm their nerves.
You've heard a lot of client stories throughout this series, and you might be wondering if we could perhaps help you. Supporting people to shift is what we do best. Health is a journey, and we can help you to navigate this with one-on-one support with our clinical naturopaths, hypnotherapists, and counsellors. If working with us one-on-one interests you, go to theshiftclinic.com and click on Shift with Us.
The Shift!
So what did you do once you graduated?
I got a residency position in New York at Mount Sinai Hospital in internal medicine, a very respected program. It's a top-tier program, very competitive to get into. I was very lucky to get into it. I think partly because I'm Hispanic, and they were looking to increase their ability to serve the Hispanic community of East Harlem. And it was great in many ways. It was a very evidence-based program, incredible training, taught me to be a really good doctor. But at the same time, it made me lose my way. So it steered me away from holistic medicine, from everything that I had been kind of aspiring towards. Back in 99, when I started my residency, there were no integrative medicine programs. Now, if you graduate medical school, you can actually choose to go to an integrative medicine program. So for me to create what I wanted, for me to be what I wanted to be, which I knew ultimately, to me, residency was just a stepping stone. It was what I had to do so I could get my medical license, get certified, kind of finalize my training. But I knew that it wasn't the end of it because it wasn't where I wanted to end up. I just didn't know how I was going to end up where I knew I wanted to end up.
So what was it about it that made you lose your way?
I think it's many things. It's the hours. At times I calculated I was working 100 hours a week. A lot of those hours are overnight shifts. You feel dehumanized by putting in so many hours. And then the hopelessness, because you realize, and it started opening my eyes to the fact that what we were in was a disease management system, not a root cause resolution system. So a doctor in training was a doctor that was trained to use drugs to help people. And you thought, well, this is really noble, until you start to realize that the drugs never resolve disease. They just keep people in disease. So there was a part of it just intuitively that I knew, like, this just isn't right. This isn't the way I wanted to practice medicine. And so by the end of my residency, I was actually very disillusioned with medicine. And I called my parents and I told them I'm kind of at that crossroads again. And I said, it feels wrong to say this, but I don't know why I became a doctor.
So what happened then? You're at the crossroads. You had to make a decision. What did you decide?
A really great opportunity came up, and it was related to the World Trade Center, 9/11. So I had lived through 9/11 when I was in my residency, and I felt very affected by the loss that was experienced in New York City. It was something you could feel in the air. You could feel it everywhere. So as I was finishing my residency, and I felt very burnt out by the very long work hours. You know, looking back, I mean, I can say that I had HPA axis dysfunction, that my adrenals had been affected. You know, it's almost inhumane what we put doctors in training through. I interviewed for the World Trade Center health screening program, and I got in. And it was a great opportunity because I call it my sabbatical year, because it allowed me to just work 40, 45 hours per week. Have the weekends to myself. So it gave me the time I needed to feel human again after a very intense training where, you know, you see people die. You know, there's a lot that goes on in the hospital because you're seeing the sickest of the sickest, and it can have an emotional toll on you. So that year that I took off, that was my sabbatical, I call it, and I was able to work with 2 other friends for my residency. So it was kind of nice to be almost like with very close friend who was like family. It was really an amazing year. So during that time, I set up a vacation with a friend of mine, and the week we were there, I had a featured yoga teacher. And so every day we did yoga and meditation. And by the end of it, I felt absolutely amazing. And so I got back to New York and I decided that I was going to enroll in a yoga teacher training. So that's what I did. I took a yoga teacher training, and that was really transformative for me because it was what I needed to do to bring me back home, bring me back to where I had started, which was I wanted to become a holistic doctor. I wanted to be integrated. I wanted to look at the body as a whole and treat the person from the perspective of mind, body, spirit. That had been my philosophy from before I went to medical school. And so this was a return to the beginning in many ways. It was kind of like a reminder to me of why I had gone into the healing profession.
Fantastic. And so you've made this realization that you're going to go integrative and do that. What was the next steps then to go down that pathway?
So I started looking for a job, and I ended up in a job that wasn't the perfect job, but it became the launching pad for my future. I worked for a very busy primary care practice where you had to see a patient almost every 15 minutes, 12 hours a day, 5 days a week. So it was very exhausting, but at the same time gave me a lot of experience, which I needed. And I learned a lot while I was there about patient care as an outpatient rather than just hospital care where you're taking care of people who are really sick. It's kind of a different style of medicine. That went on for a year. And at the end of the year, we kind of disagreed on a number of things and just kind of like the way they ran the practice. I had tried to put my input, and I think what I've ultimately realized is that, like my father, who owned his own company, that I really didn't like having a boss. Part of the departure was because I wanted to train in acupuncture and then bring acupuncture in as a modality to the practice, and they didn't want me to do that. And I started thinking, well, who are they to determine my future? My future is mine. I choose what I want to do. I'm not going to deny myself what I know is true in my heart, the path that I want to follow, because someone doesn't want me to do it. So I ended up taking vacation time to go do the acupuncture training. And then I left and I started my own practice.
Wow, congratulations. That's fantastic. So why gut? What's the story around gut? And I know you've got your own personal story a little bit, but what was the moment when you went, gut health is my thing right now?
Well, it wasn't in the beginning. I actually found the gut patients to be very abstract and kind of disconcerting, because the way that you learn gut health in Western medicine, it doesn't really differentiate all the details of why people are sick. So you kind of hear all these symptoms that they all sound the same. Intuitively, I knew that they were being caused by different things, but you're not really taught to figure that out. And I didn't have the language or the understanding. So it wasn't until I went and started training in functional medicine that the importance of the gut and the microbiome and all that, and it started just making a lot of sense. And I thought, well, this is really interesting, because this has been, to me, one of the most challenging things to treat in patients, because I just didn't have a toolkit for it. And now suddenly I was given a toolkit to treat patients with gut issues. And so I thought, well, this is really fascinating. I start helping people with their gut issues. They come in, and I get them better. They refer a friend refers a friend. And from there, it just kept growing and growing. It wasn't that I was trying to be a gut expert. I was just doing what I enjoyed.
And why do you think that in conventional medicine, they don't look at the gut in this holistic way, or, it doesn't get that attention that it deserves?
The problem, again, is that top-down approach. It's the disease-focused approach, and it's really dictated by medication. So the solutions are dictated by what medications are available to solve a problem. And there aren't a huge amount. I mean, there's way more medications now, and there's a lot of biologicals and things, very expensive medications that you can give people for gut problems. But they don't turn it around and think, well, the biggest thing that's going through your digestive tract is the food you eat. So could the food you eat have to do with the health of your gut? And how about the microbiome? Highly unappreciated, now considered another organ of the body, or an endocrine organ, or whatever you want to call it, because it's so metabolically active that we couldn't survive without our microbiome. So it's such a difference in the approach, looking at the roots and understanding why the tree is sick, rather than trying to paint the leaves green when they're looking ill by using a medication as a Band-Aid.
So let's get into a bit of the nitty-gritty around gut health. Can you tell me a little bit about what kind of things the microbiome manufactures, and in particular looking at things like neurotransmitters and then the effect that that would have on the body?
Well, the microbiome produces a whole bunch of very important byproducts of their metabolism. Among them are neurotransmitters like GABA, which is inhibitory neurotransmitter, so it helps you feel calm. So when they've done studies feeding women kefir daily and then measuring their anxiety scores, they did one study where they did this for, I think, like a 2 to 4 week period, and they found that anxiety scores lowered by just having 8 ounces of kefir every day. So we know that there's this interaction with our bodies and our brain with the microbiome. But the other thing that they produce, which is key and so important, are short chain fatty acids. And those are the metabolic byproducts of fiber that gets consumed by the microbiomes. Fibers are just undigestible starches. They're oligosaccharides that we can't break down. So short chain sugars that we don't have the enzymes to break down, but the bacteria, they do. They can use it for energy, and they produce these short chain fatty acids that are used by the cells that line the colon as energy, for example, butyrate. But butyrate also has a whole bunch of modulatory effects throughout the body, including regulating blood sugar insulin sensitivity, and neuroplasticity, so helping your brain form memory, is connected to the microbiome, which is connected to your diet and your intake of fiber.
Is there research showing that butyrate is associated with neuroplasticity?
Yeah, because butyrate has epigenetic effects on histone deacetylase, which controls DNA expression, and particularly in the production of brain-derived neurotrophic factor. And it's a short-chain fatty acid, so it's fat-soluble, which means it can cross the blood-brain barrier. So when it gets to the brain, it turns on genes that produce brain-derived neurotrophic factor, which is used to create neural connections, so memory and neuroplasticity.
What about moods? What about gut and moods?
So important, and that is tied to a multitude of things. We know that bacteria have a pathway called the shikimate pathway. That pathway produces 3 very important aromatic amino acids. 2 of them are used to make neurotransmitters. So tyrosine, which is a product from that pathway, is used to make dopamine. And dopamine is kind of like the feel-good hormone. And then the other byproduct is tryptophan, which is the precursor for serotonin, which is the happy neurotransmitter. The last one is phenylalanine, but that one is not as important in terms of brain health. So we know that the majority of serotonin in the body is actually coming from the gut, not from the brain.
Have you listened to Season 1 of The Shift? If you're enjoying the expert series, you'll love Season 1, where we deep dive into the field of gut health with 25 of the world leaders in this area. Head back to your podcast app and find Episode 1. It's a great place to start.
The Shift!
What about autoimmunity and gut? Is there any connection there?
Absolutely. I mean, one of the clearest examples is patients who have the autoimmune condition celiac disease, which is an autoimmune intolerance to wheat. They have a much higher tendency to develop other autoimmune conditions, for example, like autoimmune thyroiditis, or otherwise known as Hashimoto's. But there is an increased risk for autoimmunity with these conditions, because what happens is that your immune system, of which 70% lives along your gut lining, the immune system is constantly surveilling what is coming through. And if the gut is leaky, then more things that are not good are going to come through, and they're going to activate that immune system. Sometimes there's things that play into what we believe is one of the possible links to autoimmune disease, which is molecular mimicry. And then it causes the body to form antibodies to, say, an invading bug, but then it looks very similar to a body tissue, and the body ends up attacking the tissue itself. I mean, that was part of my motivation for going gluten-free when I did finally in 2008, as I was figuring out all my gut issues. But I really took that seriously because around that time, I had learned that my mom had seronegative rheumatoid arthritis. And my older sister, has multiple sclerosis. So I realized with the weakness in my gut and the imbalances that I had had for years that I was probably a setup for an autoimmune disease myself. And I decided, well, I need to take things into my hands before this evolves into anything. And that's when I really got serious about changing my diet and going gluten-free and taking dairy out and really figuring out my gut issues. So at the same time as I was working with patients, I was working on myself as well and healing my own gut.
Yeah, and that's like a really powerful way to get that insight and that knowing, I guess, and really make it hit home that this is really important. What's the number one symptom that people come in with you that bothers them the most?
I would say bloating is number one. No one wants to be bloated, especially women, because it makes them feel fatter.
What's the difference between if somebody is actually bloated or they have belly fat? Because I know that for me, I have a lot of patients who are women and they come in and they would identify themselves as bloated, but they don't have pain and they don't have discomfort, but they've actually got a little bit of a tummy there. How can you tell the difference?
Well, bloating will come and go. So bloating is not constant. And a lot of times, bloating will be least in the morning after you haven't eaten for the night. So you've rested the stomach, and that reduces the endotoxemia that follows eating. So the inflammatory lipopolysaccharide, so it's a membrane component of gram-negative bacteria in the gut that gets into the bloodstream, and it happens more after we eat, but it's worse if your gut is leaky. So when you give the gut a rest, like during an overnight fast, endotoxemia reduces, inflammation reduces. So a lot of these people wake up and they say, well, my tummy is the flattest, or I feel the thinnest in the morning. And as I start eating, as the day goes on, I get more and more bloated. And by the evening, I feel like I'm 3 months pregnant. So that's a very common complaint. Not everyone is like that. If someone has small intestinal bacterial overgrowth, they might feel more even bloated when they first wake up in the morning. But the characteristic of bloating is that it does change over time.
And what are the causes of bloating?
Well, the primary cause is going to be excess gas production, hydrogen or methane, by the bacteria in the gut. But if you look upstream from that, the reason that's happening is maybe you're not absorbing your nutrients, so more of them are getting to the bacteria in the end of the small intestine and the large intestine and getting fermented. Had they been absorbed better in the upper small intestine, then there would be less of those nutrients, so you wouldn't get as much gas production and bloating. So ultimately, there can be many causes to bloating, but a primary one could be digestive enzyme insufficiency, whether it's not insufficient, not enough stomach acid, or it could be damage to the brush border in the small intestine, so that very fine repetitive border that looks almost like one of those brushes, the combs. It's got many, many fingers going inwards, which increases the surface area. But when it gets damaged, you lose part of that. So it can absorb nutrients well. And part of what's produced on those fingers, that brush border, are enzymes. So when it gets damaged, then it's producing less enzymes. So again, another reason that food starts not being digested well. And you can get things like fat malabsorption, where you don't absorb your fat well. You could have, a lot of women have had their gallbladders taken out, and that can cause problems with fat malabsorption. That can cause a lot of bloating if they eat too much fat in one meal. So there's a lot of different potential causes. There's, I mentioned earlier, small intestinal bacterial overgrowth. But another cause that I see that is often overlooked with a lot of people is yeast overgrowth, or candida.
Can you tell me about a time in your life where you made a massive shift?
I think the first one is what I described in the beginning, was when I kind of decided to take my whole fear of needles and all that into my own hands and figure out what was going on in my body. Another one happened after an accident when I was 19 years old. I was in a bike accident. I can't remember. I know that I was biking into a parking lot, and I must have hit some rocks, and I ended up crashing into the floor head first, knocked unconscious, and ended up in the hospital. And up until that point, my life had been about drive and pushing and excellence and being the top student and a 4.0 GPA. And it was that moment that made me realize that I wasn't taking the time to live life. That I needed to change my perspective. So it's like it took that head injury to get me to realize that the way I was living my life wasn't serving me at the time.
Why do you think it takes sometimes a really big event like that for us to realize these things?
I think because we're not listening. And so we've got to hit our heads against the wall. I mean, for me, literally, I hit my head on the pavement. And I think if you don't listen to the cues, that the signal becomes louder and louder until you finally listen. So you can learn your lesson, because ultimately we're here to learn lessons and to evolve.
So here's a question for you that sort of is in that same area. Is it outside of people not eating properly, or environmental toxins, or any of that stuff? What do you think is the deeper reason that people get sick?
I mean, I think ultimately people get sick first in the mental, emotional realm, perhaps the spiritual realm, and then it condenses into something more significant. Perhaps it's a part of them that is not fulfilled, there's always a wisdom in the body. So it's almost like the body, when you're not listening, one way for the body to get you to listen is to get sick, to get you to pay attention, to hit the pause button so you can do something that you are meant to do. I mean, how many times do people get sick when they're running too hard, running themselves ragged, and then they are forced to stop and take care of themselves? I think ultimately, there's a lot of physical causes for illness, but our experience of everything is dictated by our minds.
I love that. Thank you. One last question. So if you could give someone that was wanting to make a shift in their health just one piece of advice, what would it be?
The shift begins with you, and that begins with a shift in your belief system. Sometimes what I tell my patients is that it can be as hard as you want it to be or as easy as you want it to be. And I think it's as easy as that. If you think it's going to be hard to change your diet and your lifestyle, then it will be hard. If you decide to tell yourself a different story, that it's going to be easy, then you can live that story. And I know it sounds so simple. They're like, well, it's so hard to change lifestyle. I'm like, well, what if you tell yourself the story that it isn't hard, that it's actually easy, that you can do it? What if? Imagine that and just make it so.
Thank you so much.
What a great episode with lots of insights from Dr. Vincent Pedre there. Let's make sure we've gotten the key points and what actions you can take as a result of it. Number 1. I know we've spoken about this before, but it's so important to take a holistic view of health. Integrative doctors like Vincent are so important, and we need many, many more of them. If it's not possible for you to see an integrative doctor though, then perhaps a naturopath or other natural health practitioner in combination with your general practitioner is the way to go. Number 2. Your microbiome has a profound effect on your moods, given that most of your neurotransmitters like serotonin and GABA are produced there. Number 3. The microbes in your gut make butyrate, which has been shown to increase brain-derived neurotrophic factor, or BDNF. This is a really big deal because BDNF has been shown to protect your brain, create neuroplasticity, and even to prevent degenerative diseases like Alzheimer's and dementia. Plus, it has a role in preventing depression, so BDNF is the friend that we want around. We can get more by having healthy butyrate-producing microbes in our gut. Number 4. As we discuss in episode 4 of The Shift, bloating is the most bothersome symptom that people experience, and it can be caused by many different issues. Common causes include indigestion of food particles that lead to fermentation and gas production in the microbiome, as well as food intolerances. Knowing is great, but doing is better. Here are 3 things that you can do as a result of this conversation. Number 1, if you're experiencing mood issues, make sure you look at your gut as part of a comprehensive treatment program. This might mean getting a microbiome analysis or following the dietary recommendations in episode 10 of The Shift. Number 2, if you're bloated, look to food intolerance and assess things like gluten and dairy to begin with. Then you want to upregulate your natural digestive function to make sure you can digest the normal foods that you're eating. You can do this by consuming things like apple cider vinegar and eating bitter foods. This is a key area that we work on in my Gut Shift program and something that you should focus on too. Number 3, think about how you can shift your belief systems. We're usually the person that gets in our own way most of the time when it comes to healing. Observe your thought process. What are you telling yourself day to day? Do you actually believe you can get better? Do you need to change your internal story in order to shift? These are really important questions, so it pays to take some time to ask yourself what they mean for you. I hope you enjoyed this conversation with Dr. Vincent as much as I did. I'm really looking forward to connecting with Vincent for season 2 of The Shift, which is all around emotional health. To learn more about Dr. Vincent, visit his website pedremd.com. That's pedremd.com, where there are heaps of excellent resources for you to tap into. Dr. Vincent also has a 3-day anti-inflammatory gut reset that you can join online at happygutlife.com/gut reset. Links will be provided in the show notes as always. In the next episode of The Shift, we have UK nutritionist Jenny Tishi, otherwise known as the Lunchbox Doctor, who will be giving us some amazing nutritional insights that you won't want to miss.
Coming up on The Shift.
What do you think the implications of giving these foods to young children are?
It's an incredible strain on the immune system.
Why do you think people are so disconnected from what's going on in their bodies?
I think we just live in such a fast-paced community, a fast-paced life at the moment.
Why do you think there's more kids that are sick than before?
Again, I think it comes down to that sort of multifactorial lifestyle and environment.
Some of the concepts we explore on this program will take 17 years to make it into your doctor's office. The change needs to come from us, so I ask that you please share this knowledge. I don't care how you do it, a text, an email, a private Facebook message, or showing a friend over coffee. Let's get this information out there.
The Shift!